And to hear more on the arrival of the Cuban doctors here, we joined via Skype by the Health Professions Council of South Africa President, Dr. Kgosi Letlape. Dr. Letlape, very good evening to you. Thanks for joining us. Welcome.
Good evening to your viewers.
Do you, first of all, welcome the Cuban doctors' assistance to South Africa?
Yes, we welcome their assistance. As we all know, we do not have sufficient doctors and other healthcare professionals in our system, and any assistance is most welcome. We also know that historically, the Cuban doctors have been helping us, particularly in our rural areas, for quite a number of years. Ever since the cooperation agreements under Nelson Mandela.
But would the Cuban doctors' assistance be in any way helpful at all when trained healthcare professionals in South Africa remain unemployed? The Democratic Nursing Organization of South Africa, for instance, says it's unpatriotic roping in the assistance of the Cubans when South African doctors and nurses remain unemployed.
I think I will not speak on behalf of the nurses. And from the information that we have, there are no nurses in the contingent of professionals that have come into the country. We have doctors, we have epidemiologists and other experts in terms of pandemic disease, which are most welcome in terms of assisting us. We hope that as they come in, they will be working with local healthcare professionals. They'll strengthen the team, and they'll also be able to transfer knowledge in areas where they may be better than we are.
So do you think that the current crop of the medical fraternity, the current crop of doctors in South Africa wouldn't perhaps have done a much better job?
But as we have said, we don't have sufficient doctors. If you go into our rural areas, there are many posts that are not filled. There are many South Africans that need doctors that have no access to doctors. And I think we should be pragmatic and welcome the helping hand. We just hope that they are going to be working with the healthcare professionals in South Africa, that this becomes an opportunity for us to strengthen our healthcare system and increase our response to COVID. There is no nation, even richer nations than South Africa, have run short of human resources. Places like England are for doctors. Places like the USA are relaxing and trying to poach doctors from the continent. So we welcome any assistance that would come from the Cuban people.
I guess that's what fuels the criticism then of roping in the Cuban medical assistance, when you've just said that there's so many vacancies that still remain unfilled in South Africa. Do you not think then that South Africans should have been prioritized first before bringing in external assistance?
I think we need to be frank and truthful. In most countries, there's maldistribution of doctors, no matter what numbers you have. Most doctors, like me, prefer to settle in urban environments. The environments for living are quite attractive. There's opportunities, if you have a family, for your spouse to be able to work and for your children to become educated. And the posts are not filled, particularly for doctors, because we choose not to go to those areas. And there isn't sufficient of us to go out there. Long term, we have to sit as a nation to come up with a proper human resource plan and look into the incentives to be able to attract doctors to the underserved and the rural areas.
Well, no doubt that the Cuban health fraternity or the medical fraternity is world class. I mean, Cuba is renowned for its medical diplomacy. The country boasts the highest ratio in the world of doctor to population. And Cuba is the so-called world medical power, and healthcare is a basic human right in that country that is solely the responsibility of the state. Do take us through, Professor, if there is a difference with regards to the Cuban health prowess compared to African health expertise, particularly the South African health expertise.
I think the main system is the ethos of the Cuban people. In South Africa right now, we're talking about the Cubans coming to help us in the public sector. Now in Cuba, they have a national health system. It's one system for all Cubans. That is what the NHI purports to do. I think the biggest difference is that if you remember, when Fidel Castro had health issues, he didn't fly out of Cuba to go elsewhere for treatment. He was treated in the same system that all Cubans use. So I think the main lesson from Cubans is about solidarity. The main lessons from Cuba is about the national health system. The main lessons from Cuba is to make your work environment attractive to your healthcare professionals so that they are able to fulfill their oath in terms of being able to take care of patients to the best of their ability, ably assisted by the state to take care of people based on need rather than means. And that is the biggest thing that we could learn from them. The other main thing is the primary healthcare focus. If you look at COVID-19, there is no cure. There's supportive treatment. And the main way you get out of COVID-19 is through basic primary healthcare. Promotion of health in terms of hygiene, cough etiquette, cleaning of surfaces, a hygienic environment, physical distancing, and all those issues are relatively affordable. Physical distancing costs nothing. Cough etiquette is a matter of education. Being able to have practitioners that practice in the community and take care of communities. An information system that would make tracing people quite easy. A population register and treatment protocols that are national. So there's a lot that we could learn from them. But one of the main issues is their emphasis on health rather than building a system to deal with the sick. So you also need to promote health, promote well-being, and have an ability for citizens that need curative services to be able to access them not on the basis of their means, but on the basis of their needs.
No, Dr. Letlape, you've so eloquently articulated the social element or the social facet of the Cuban medical fraternity. But then for purposes of understanding what is it that Cuban doctors can do that South Africans cannot do, what is it then? I think we need to extend our analysis as to what is it that they hold over South African doctors.
I think it's not so much what the Cuban doctors can do that we can't do. It's more the Cuban system as opposed to the South African system.
Right.
And the focus should not just be on the doctors. The focus should be on the system and the whole range of healthcare professionals. We've seen through COVID where the differences in our societies have become more pronounced or visible to privileged South Africans.
Okay.
The issue of safe housing, the issue of access to water, the issue of promotion of healthy lifestyles is key. So let's talk about a health system rather than a system to take care of the sick.
Okay. So how do you see this deployment playing out, Dr. Letlape? Do you see the Cuban doctors being independently deployed to the different parts of the country while South African doctors are deployed elsewhere as they already are, or do you see them working together in one discipline?
As you've heard from the president, he's talking about the Cuban doctors assisting us and working with doctors that work in South Africa that are on the ground. So they are not coming here to take over from us.
Okay.
They are coming here to assist us. And what we're hoping to see as a Health Professions Council, we have just under 200,000 healthcare professionals that register with the Health Professions Council, in addition to the over 200,000 nurses that register with the Nursing Council. What we're hoping to see is them coming to aid us in our responsibility to take care of our citizens. It's not them coming to take over. Remember also, they need to be paired with locals,
right,
because there would be issues of communication barriers.
Sure.
So they are coming to assist us rather than to replace us or take over from us. And we're hoping, we will be engaging with the ministry to ensure that this becomes a cooperative exercise that all of us benefit from. Not just the patients in South Africa, not just the people of South Africa, but the healthcare system of South Africa.
And I suppose then they will come in handy because of their emphasis on primary health care, particularly at the community and local level where their assistance is needed the most. Dr. Letlape, thank you so much for your time. We appreciate it.
Thank you very much, and thank you for the opportunity.